Hello, I am Susan Baumgaertel, and welcome to Navigating Your Health with myMDadvocate, Episode 6, Am I in Menopause? Woohoo! Okay, ladies, pull up a chair. Okay, scratch that. This video is for all people to watch and appreciate, not just women, but of course, women going through menopause will benefit the most. So gather around. It's been said that menopause is like puberty, only backwards. Well, there's much truth to that concept in many respects from a hormone-related perspective, but it just doesn't completely capture the magnitude of differences that come with aging and maturity. So life can already feel like a roller coaster, right? And with the menopausal years looming, you just don't always know what to expect. So the beginning of this journey can be quite confusing, to say the least. And boy, you'd like to know what menopause is, right? How do you know you're in menopause? And what does that actually mean? What do you need to know as you're starting into this menopausal journey? What should you focus on? And how do you navigate? That's really kind of, that's it in a nutshell. And really, I think the biggest part of communicating this process is talking about definitions. So there are a number of definitions that people stumble over and maybe go to the web and still don't quite understand. So let's kind of go through those. And I think this is key for everybody. So pre-menopause, pre means before. Premenopause just means before menopause, right? So all those years, periods haven't changed, hormone levels have not shifted. There are no typical signs of menopause. So, you could be in your 30s even or 40s. Perimenopause, P-E-R-I, peri means around. Think of like perimeter or periscope. So perimenopause is kind of that whole time frame when things are starting to change. Hormones can be variable or not. You could have zero symptoms. You could have a whole host of symptoms. You could have ones you're not even quite sure, is this menopause or what's going on here? And typically, I would say this is the most challenging leg of the menopausal journey. So often periods are spotty, or you can be irregular as rain, and then suddenly, boom, nothing. And then 4 months later, you have periods again. So it's just a lot of confusion, and that harkens to, I guess, the theme of this midlife process anyway. Menopause. Menopause means you are done. Yay. Menopause typically occurs, I guess statistically between 47 and 52. But, it could be 46, you could be 55. So there's a lot of leeway there depending on the person. And, it means you've gone 12 months without a period. That's the definition of being in menopause. So being in menopause is the same really as saying postmenopause. So post means after, and postmenopause, means menopause and beyond. So really you're postmenopause until you're at the end of your life. And that's where people kind of get hung up. I've met many folks who say, well, I'm 72, that's long ago. Well, you're still postmenopause. You will always be at that age. So a couple other terms are important. One is natural menopause, not to say, not to talk about like natural supplements, but natural menopause is really just the journey everyone with ovaries is on. And then there's surgical menopause, if both of your ovaries are removed. So no more hormones being produced. And a hysterectomy, that just means removal of the uterus. Doesn't always remove the ovaries. There are many, many circumstances that your surgeon will make that decision with you on. And so an oophorectomy, which means removal of an ovary or both ovaries, is what I'm talking about. So if both ovaries are gone, you are in surgical menopause. And this can be challenging because it's literally like a switch was flicked. And so, pre-op, you were whatever you were, depending on the circumstance. Post-op, boom, if both ovaries are gone, you are now postmenopause. So that's often a tumultuous time period, but fortunately there are solutions. So premature menopause, premature means early, so it means early menopause. And again, when I said, average time frame for menopause is 47 to 52, it could mean it's 42, or it could mean it's 31 or 28, so it just means before menopause is typically expected. It's often always unexpected and typically unwanted, especially for women who are trying to have children or thinking about families. So there's another distinction, premature ovarian insufficiency, or POI, premature ovarian insufficiency, which is, I guess, in essence, premature menopause. It is often not with a cause. There's nothing to blame. There are some family inheritable traits or genetic disorders, thinking like Turner syndrome, cancer treatment. So if someone's had radiation therapy or chemotherapy that's impacted their reproductive system, then that could be a cause of premature ovarian insufficiency or early menopause. And some even infections or autoimmune diseases. So there's a lot of reasons for that. I want to end this whole definition talk with one important definition that you may hear a lot, and certainly your doctors talk about, and it's called DUB, and that stands for dysfunctional uterine bleeding. And in a postmenopausal woman, dysfunctional uterine bleeding needs to be investigated. What that means is you've gone 12 months without a period, yay, you're in menopause, life goes on, suddenly you have bleeding. That is not normal. That has to be investigated. So enough with those definitions. So let's dive into the details. Again, we're talking about MI and menopause, right? So I have always advised patients through my entire medical career, expect the unexpected. Yeah, because that's what it's all about. So menstrual periods can be shorter, longer, heavier, lighter, more clots, less clots, more painful, less painful. You get the drift. I mean, just really anything and everything. And, some of you may be happily done with your periods for 7 months, and then just boom, a period from hell comes out of the blue and like completely unexpected. Others will kind of skip around a bit and you miss a period, or maybe things are, here and there. And so you're not really sure if things have truly ended. So again, that leads to the confusion and the frustration part of it. So all of these experiences are considered completely in the normal realm, sorry to say. And so this can be frustrating to learn, but doesn't that just mirror life? So I'll leave it at that. Perimenopausal hormone fluctuations are at the root of most symptoms, so not just the changing periods. So, you can get skin conditions that pop up out of nowhere, like teenage acne, right? Puberty backwards, or mood changes or irritability. Oh my gosh, that's a big one. And those are pretty common. But it's the period changes that get the most attention, especially for those who have really been regular as rain. Now, unpredictable periods can be sometimes far more than just an inconvenience, right? So work tasks, disruptions happen. Maybe you don't have a bathroom accessible at your workplace. That's a big deal. Emotional irritability can just extend to actually worries about pregnancy. That first missed period, oh my God, I'm pregnant. So this is often, it just heightens anxiety and the angst and kind of that distress that sometimes can, not always, but sometimes accompany this time frame. Oh yeah, and by the way, menstrual products are not really cheap, right? So, not knowing when a period will start or end is stressful. Having menstrual bleeding that lasts for several weeks or coupled with more frequent menses may lead to actually blood loss, and you can develop iron deficiency anemia. Not uncommon, actually. So this in turn can contribute to fatigue, and especially when frequent or heavy or lengthy periods that just never seem to end over many months or even longer. So that is a consequence or potential consequence, and sometimes that really needs to be evaluated or treated. Thankfully, for those without contraindications, hormones can be helpful, either the oral hormone kind, which we call birth control pill, or an IUD, intrauterine device. And these are the two most common approaches and typically work quite well for many women. And these treatments can be continued actually in the subsequent postmenopausal years and beyond, sometimes kind of putting a damper on those postmenopausal symptoms, be it hot flashes or night sweats or genitourinary syndrome or vaginal dryness. So those can be nicely managed. I'd be remiss in not emphasizing that there are many non-hormone options for early symptom management. And these range from, herbal remedies, supplements, non-hormone prescriptions, the other way around, and even acupuncture and therapies like cognitive behavioral therapy and such. So that's important to know that you don't always have to just jump to hormones. So what about premature menopause? So this can be due to surgery, right? So hysterectomy plus oophorectomy, or just oophorectomy, ovaries are gone, or due to premature ovarian insufficiency, POI. And if these situations apply to you, then natural menopause may be a bit more challenging to confirm because you no longer get your period, right? So you can't base that, am I in menopause discussion on 12 months after your last period because you're not having periods. So it's, again, we kind of slide into that kind of, are you in the typical age range, mid to late 40s, early to mid 50s? That can often be a gauge. Symptoms are usually the giveaway. Are you suddenly having more hot flashes, night sweats, and so on and so forth? But, occasionally hormone blood levels can be helpful and necessary for confirmation. But in general, as a rule, going through menopause otherwise is a natural process, and you don't need to constantly check hormone levels. Now, there are some who have menopause induced by medical treatments, such as chemotherapy. And, the same principles apply in terms of if you've had your ovaries removed, but, each individual scenario needs to be discussed with your personal physician. Again, hormone therapy options may or may not be valid for these situations. So an important point. So let's kind of pull this together and think about kind of a few quick final points. Number one, you are not going crazy. I know it thinks like you are. Number two, expect the unexpected. That's really, that's what it's all about. Number three, hormone fluctuations can persist for months to years, causing many changes in periods before they ultimately stop. Number four, for those who have heavy and prolonged periods, be on the alert for iron deficiency anemia because that can certainly contribute to fatigue. Number five, different hormone regimens can definitely help the menopause transition. So that's really on the docket. Number six, there are many non-hormone remedies as well, as I mentioned. Don't forget about that. And lastly, number seven, this midlife transition should really remind us, all of us, to focus on things that impact our overall wellness as we age. So, movement, nutrition, sleep, stress, connection to others. I think you've heard me talk about that before. So a great time to reconnect with that internal process and spend some time with yourself. So I would be remiss if I didn't mention that there are a few additional resources I can talk to. One is my website, menopausmenu.com. And there's lots of goodies. Just go to the information tab and there's 16 things that pop down. And of course, there's blogs and videos and such. I'm writing a book. It's called The Menopause Menu. Fancy that. And the manuscript's done, and I'm currently looking for literary agents. So sometime in the future, when you're watching this video, let's hope the book is out. And again, contact me for more resources if they're needed. I have lots of things at my fingertips, so you don't have to go just daringly on Dr. Google. All right. Well, I hope you enjoyed spending a little time learning about the menopausal phases and what to expect early on. Now, please join me again soon for episode 7. I need help with weight management. All right. Thanks for watching. Have a great day.